Getting there, he's getting there.
Hello, Miss Amanda. How are you?
Good, how are you?
Good, good. Happy to see you again. Congratulations.
Thank you so much.
I'm doing good too.
How are you doing? Good?
I'm the husband. Nice to meet you.
Nice to meet you. So what brings you here today?
So whenever I'm brushing my teeth, I notice like all this blood coming out, right?
Lots of
I
blood.
know, it's so strange.
Oh,
Freaks me out.
It's actually very common in pregnant women. So we are gonna want to check that out. But before we do, we want to check your blood pressure. It's
Okay.
pretty standard, just to make
Okay.
sure that everything is going well.
Okay.
So let's do that really
Okay.
quick, okay? That actually looks a little high.
Oh.
Yes. So I'm gonna call the gynecologist and I'm gonna consult with your gynecologist. I think we have it in records.
Okay.
Before we continue with the dental procedure, okay?
Okay.
Just to make sure everything is good.
Okay.
All right?
Thank you.
So I'm gonna go do that in my office and I'll be right back.
Okay.
Hello?
Hello. Yes, this is Dr. Gomez calling. Yeah, I have Miss Amanda here in my dental office. She's one of your patients. Yeah, she was telling me she's on her second trimester, and she was coming in because she was complaining about bleeding gums. So I measured her blood pressure before we did any dental procedure, and it seemed like it was very high.
So since she has hypertension, she's in her second trimester, and she's showing evidence of periodontal disease, we should probably take her to the ER immediately because she might have preeclampsia.
Oh wow, okay. Yes, it's good that I call you then. Yeah, let me let her know that she needs to go to the emergency room.
So this is a great example of why we need to involve other healthcare professionals within our treatment planning, as patients can present with other outstanding conditions that might not be able to be treated solely by a dentist.
My name is Kevin Howe, and I'm a second-year medical student. I think it's been really useful learning about how dentistry influences the overall well-being of our patients. For example, patients who undergo dental procedures are sometimes known to develop an endocarditis, and knowing that that's a risk factor has been really useful as something to look out for in the future. And similarly, patients who have excessive bleeding after dental procedures are often known to have disorders of hemostasis. And so that's just another thing for us to look out for as physicians that we might not have been aware of due to the differences in our training.
Hello, yes. No.
No.
Nice.
Well, congratulations, guys.
You started? Alright, do one thing.
You want to make sure you propose to her, right? Ask for her father's blessing. 1 second.
Important conversation, right?
And then marry her, okay? And you pay for the wedding. Got it?
Me pay
Pay for the wedding. Yes.
What's the father that pays for the...
You pay for the wedding. Listen, respect.